Good morning. I'm Dr. Don Shenenberger from Peninsula Dermatology in Newport News. This morning I'm having a colonoscopy. I had my first one 10 years ago after I turned 50. I screen people for skin cancer many times a day, but this time the screener needs to be screened. Skin cancer screening is important, but so is screening for colorectal cancer and many other conditions. So you should see your primary care doctor to discuss what health screening you may need.
Colorectal cancer is a cancer that occurs in either the colon, also known as the large intestine, or the rectum. If you exclude skin cancers, colorectal cancer is the third most common cancer diagnosed in the U.S. It's estimated that in 2022, there will be over 150,000 new cases of colorectal cancer diagnosed in the U.S. In spite of those numbers, the overall rate of new cases has been dropping since the 1980s. A major reason for that drop is that there are more people getting screened. In addition, people are changing their lifestyle-related risk factors. In the U.S., colorectal cancer is the third most common cause of death due to cancer in men and women. In 2022, it's expected to cause almost 53,000 deaths. And while the overall death rate from colorectal cancer has also been dropping for many years, it has increased by about 1% per year for people younger than 55 from 2008 to 2017. The reasons for the overall drop in death rate is simply earlier screening and the identification and removal of early precancerous polyps. In addition, treatments for colon cancers have improved over the past few decades. Colorectal cancers are now diagnosed earlier when treatment is most effective. Routine screening is now recommended to start as early as 45, depending on your individual risk factors, and be repeated up to every 10 years, depending on the method of screening and the individual patient's needs. Talk to your primary care doctor to determine when you should get your first screening exam.